Welcome to our channel Quaint. Today we are going to dive deep into a most fascinating topic in the world of medical sciences, or more specifically in the world of cancer treatment. The topic is magnetic hyperthermia. Though at present this is still in its early stages, extensive research work is going on in this field, and your support means people's support this is necessary in this field, especially for clinical trials, if you are eligible. Anyway, so means I wanted to say that you can contribute to this research work. Anyway, let's talk about what the technique is actually. This technique is non-invasive in nature. Okay, yes, this technique is non-invasive in nature and side effects can be minimized if this procedure is followed to treat for the treatment of cancer. Cancer such as brain cancer, breast cancer, liver cancer, all these types of cancers can easily be treated by using this procedure known as magnetic hyperthermia. Now let's talk about the technical part of this technique. Okay, what is the technology behind this? Technology is very simple but very effective. What is the requirement? If you reach to the site, and if you reach to the cancer site, means target site or the cancer site where cancerous cells are present, and if you can heat up those cancerous cells in the temperature range between 41 degrees Celsius and 45 degrees Celsius, means temperature range is 41 to 45 degrees Celsius, not Fahrenheit, it's Celsius. Okay, so if you can heat up the cancerous cells to this temperature range, within this temperature range, then in that case it will be possible for you to destroy the cancerous cells, either by destroying the DNA of the cancerous cells or by membranes, or both. Means within this temperature range, the DNA of the cancerous cells and as well as the membranes can easily be destroyed. So what is the main procedure? Main procedure is just by heating up the cancerous cells while sparing the other healthy tissues, I wanted to say that other healthy surrounding tissues. Where there is cancerous cells, healthy tissues are also present. So what is the technique is actually? Technique is here nanoparticles are used. Yes, you know the nanoparticles, means sizes are very small. Typical size varies between 1 nanometer to 100 nanometer, where 1 nanometer is equal to 10 to the power minus 9 meter, extremely small. And nanoparticles are mostly made of iron oxides, means magnetic in nature. And what is done, these nanoparticles are specially designed. Specially designed means what? Means these nanoparticles are functionalized in a special way. Some coatings are used on the surface of the nanoparticles so that they should reach to the target site. Okay, means if they find cancerous cells in your body, then only then in that case those nanoparticles should reach to that site only, due to the special surface properties of the nanoparticles. Okay, that means the nanoparticles are engineered in a special way. Desired surface properties are imparted to the surface of the nanoparticles so that they should reach to the target site. So these nanoparticles are injected into your bloodstream or into your body or into the tumor itself. Okay, either into your body, into your bloodstream, or into the tumor itself. So nanoparticles are injected in your body and eventually they reach to the target site, and therefore what happens? what is done? There is one controlled external magnetic field. Means alternating magnetic field is applied to the patient's body, and due to the presence of that alternating magnetic fields, the nanoparticles start vibrating, and that vibration generates heat, and due to that heat, cancerous cells can be destroyed easily. Though this magnetic field, this externally applied magnetic field is highly controlled, it should be highly controlled. Okay, if excessive if excessive heat is generated, then the healthy tissues will also be destroyed simultaneously. Okay, that means precise control over this technique we should follow, or the doctor should follow. Precise control should be there. Okay, so this is the main procedure behind magnetic hyperthermia. So just by producing vibration of the nanoparticles, heat is generated, and that heat destroys the cancerous cells. So benefit of this procedure is what? Benefit is this is non-invasive, you can see easily. This is non-invasive in nature. Healthy tissues are spared. They are not harmed at all. Healthy tissues. Synergy with other techniques. That means suppose the patient is needed to undergo chemotherapy or radiation therapy. In that case, if you use magnetic hyperthermia, and along with this, if you use chemotherapy or radiation therapy, in that case that will be much more effective. Means combined effect of magnetic hyperthermia plus chemotherapy, or combined effect of magnetic hyperthermia and radiation therapy, that will be much more effective for the patient. Again, in the field of theranostics, means targeting, monitoring and controlling all are done simultaneously. Theranostics means, you know, it is a combination of, it's a fusion of therapy and diagnostics. Okay, so in the field of theranostics also this can easily be used. Though I have already mentioned in the very beginning of this video that this technique is still in its early stages. Research is going on in this field, and you can contribute to this research work in many ways. First of all, you should be well informed about this technique. Okay. Anyway, so this was all about the technical details of this behind this procedure and the benefits. So benefits are what? This is non-invasive in nature. Minimal side effects are minimum, and if you talk about harm to the healthy tissues, then that is minimal actually. This is highly controlled. Okay. Anyway, so this was all about today's topic, magnetic hyperthermia. Okay, so this is the end of this video. Thank you for watching this video.